dear students, today we'll discuss some of the multiple choice questions related to heart. So we'll see the first question. Which artery is known as the third coronary artery? So you can see the options: A. Right marginal artery, B. Right conus artery, C. Left conus artery, and D. Left marginal artery. So you know that there are two coronary arteries, that is right coronary artery and left coronary artery. So the right coronary artery gives off a branch known as right conus artery that supplies the infundibulum of right ventricle. In some cases, the right conus artery arises directly from the anterior aortic sinus. So in that cases, it is referred to as the third coronary artery. So the answer to our first question is third coronary artery is B. Right conus artery. Now we'll see the other options. The right marginal artery is also known as acute marginal artery, and the left marginal artery is also known as obtuse marginal artery. Now we'll see the second question. Which sinus is known as non-coronary sinus? The options are A. Anterior aortic sinus, B. Left posterior aortic sinus, C. Right posterior aortic sinus, and D. Right anterior aortic sinus. So you know that aortic sinuses are dilatations at the origin of ascending aorta. There are three aortic sinuses, that is anterior, right posterior and left posterior. And from the anterior aortic sinus you get the right coronary artery. From the left posterior aortic sinus you get the left coronary artery. So the right posterior aortic sinus is known as the non-coronary sinus. So the answer to this question is option C, that is right posterior aortic sinus. Now we have to know that the anterior aortic sinus is also known as right coronary sinus, because the right coronary artery takes origin from the anterior aortic sinus. That's why it is clinically known as right coronary sinus. Whereas the left posterior aortic sinus is known as left coronary sinus clinically, because from there the left coronary artery arises. Now we'll see the third question. In trifurcation of left coronary artery, the arteries involved are. So option A, anterior interventricular artery, circumflex artery and posterior interventricular artery. Option B, LAD, diagonal artery and marginal artery. Option C, posterior interventricular artery, diagonal artery and circumflex artery. Option D, LAD, diagonal and circumflex artery. So you know that the left coronary artery arises from the left posterior aortic sinus. So soon after it arises, it divides into its major branches, that is the anterior interventricular branch and the circumflex artery. And one of the ventricular ramus that is arising from the anterior interventricular artery is known as the diagonal artery. In some cases, the diagonal artery becomes larger and it is seen at the junction of the anterior interventricular artery and also the circumflex artery. So in those cases, it seems that the left coronary artery trifurcates into three, that is the anterior interventricular artery, circumflex artery and diagonal artery. So the answer to this question is option D, that is LAD. LAD is other name for anterior interventricular artery, then diagonal artery and circumflex artery. So fourth question, which coronary dominance is more dangerous? Option A, right, B, left, C, balanced and D, codominance. So you very well know that the left coronary dominance is more dangerous, because the coronary dominance depends upon one vessel, that is posterior interventricular artery. So if this artery arises from the right coronary artery, it is right coronary dominance. Usually it arises from the right coronary artery. If this arises from the left coronary artery, it is left coronary dominance. And if this artery arises from both the coronary arteries, it is balanced or codominance. Both are the same. So what is the effect of left coronary dominance? In case of left coronary dominance, the left coronary artery, since the posterior interventricular artery is a branch of left coronary artery, in this case So the left coronary artery has to supply the bulky myocardium of the left ventricle and also has to supply the major parts of the conducting system of heart, and also the whole interventricular septum has to be supplied by the left coronary artery. So when the demand increases, there is more chance of infarcts and more chance of myocardial infarction. So the posterior interventricular artery, if it is a branch of left coronary artery, it is more dangerous. That's why we can say the option B is the right answer, that is the left coronary dominance is more dangerous. Next question. All are true about the left coronary artery except A. It arises from the left posterior aortic sinus. B. It is shorter than right coronary artery. C. It supplies the right bundle branch. And D. Posterior interventricular artery is a chief branch. So we know that the left coronary artery arises from the left posterior aortic sinus. It is shorter but a wider caliber. And it supplies the right bundle branch. That is also right answer. Whereas the posterior interventricular artery, we know that it is a branch of the right coronary artery. So before seeing the right answer, we will see the conducting system of heart. In 65% of cases, the SA node is supplied by the right coronary artery, whereas in 35% of cases, it is supplied by the circumflex artery. So that means right and left coronary artery equally supplied. Now, whereas in the AV node, in 80 to 90% patients, it is supplied by the right coronary artery, and 10 to 20 it is supplied by the left coronary artery. In the AV bundle is supplied by right and left coronary artery. But you have to remember the right and the left bundle branch both are supplied by the left coronary artery. So the answer to this question is option D, that is posterior interventricular artery is not a chief branch. The anterior interventricular artery is a chief branch of the left coronary artery. Next question. The following tributaries of coronary sinus have valves except. Options are A. Great cardiac vein, B. Middle cardiac vein, C. Posterior vein of left ventricle, and D. Oblique vein of left atrium. So we know the coronary sinus is the main vein of the heart. It has got many tributaries. The great cardiac vein, it passes through the anterior interventricular groove and reaches the left end of the sinus. Whereas the middle cardiac vein, it passes through the posterior interventricular groove. Then we have the posterior vein of left ventricle, which is just left to the middle cardiac vein. And then we have the oblique vein of left atrium. So you can see here the first three tributaries that I have told, they are draining from the lower part to the upper part. The coronary sinus is in the coronary sulcus or the posterior part of the atrioventricular groove. Only the oblique vein of left atrium is draining from the posterior surface of the left atrium towards the coronary sinus. That means it is flowing from above downwards, draining from above downwards. So it does not need any valves. So the answer to this question is oblique vein of left atrium. That means only this vein doesn't need any valve because it is draining from above downwards. The next question is, which artery is known as widowmaker artery? The options are left circumflex artery, left marginal artery, left cornus artery, and left anterior descending artery. So it is a direct question. Widowmaker artery or the artery of sudden death is left anterior descending artery, which is otherwise known as anterior interventricular branch of the left coronary artery, because commonly it gets occluded in myocardial infarction. So the first artery to get occluded in myocardial infarction, in about 40 to 50% patients, it is the anterior interventricular artery or the left anterior descending artery. So the answer is D, that is left anterior descending artery. The next question is, the following structures lodge in the posterior interventricular groove except. The options are posterior interventricular branch of the right coronary artery, the small cardiac vein, middle cardiac vein, and anastomosis of the interventricular branches of both coronary arteries. So since it is a posterior interventricular groove, we know that the posterior interventricular branch of the right coronary artery is a structure that is lodged in this groove. Then you have got the middle cardiac vein that I have discussed in the previous question, middle cardiac vein. Then anastomosis of the interventricular branches of the right and left coronary artery. So here only the small cardiac vein doesn't pass through this. It passes through the right atrioventricular groove. So the answer to this question is option B, that is the small cardiac vein. The next question is, areas supplied by the right coronary artery are all except A. Right atrium, B. SA node, C. AV node, and D. Anterior superior 1/3 of the interventricular septum. So we know that the right atrium is supplied by the right coronary artery. SA node in 65% of population it is supplied by the right coronary artery. AV node in about 80 to 90% of population it is supplied by a loop, that is an inverted loop, artery with an inverted loop arising from the posterior interventricular artery, which is a branch of the right coronary artery. Now see the D option, anterior superior 1/3 of the interventricular septum. So is it anterior superior 1/3? So you can see here the anterior superior 2/3 is supplied by the anterior interventricular artery, which is a branch of the left coronary artery, whereas the posterior inferior 1/3 is supplied by the posterior interventricular artery, which is a branch of the right coronary artery. So the answer to this question is option D. It is not anterior superior 1/3, but it is posterior inferior 1/3, whereas anterior superior 2/3 is supplied by the anterior interventricular artery, which is a branch of the left coronary artery. So the last question, coronary sulcus is anterior interventricular groove, interatrial groove, posterior interventricular groove, and atrioventricular groove. So you know that atrioventricular groove is having 3 parts. So the first part is the right anterior part, that is passing between the right atrium and the right ventricle. The second part is the posterior part, that is winding the heart. And the third part is the left anterior part. So that means it is encircling the heart like a crown. That's why it is known as coronary sulcus. So the atrioventricular groove is known as the coronary sulcus. The other 3 grooves are not known as the coronary sulcus. Since this atrioventricular groove is having 3 parts, that is winding around the heart like a crown, and also in the posterior part of atrioventricular groove, the main content is the coronary sinus. Because of that, you can say the coronary sulcus is the atrioventricular groove. I hope this session was useful for you. Thank you.